Yeah, I'm Dr. Kimberly Watt. I'm a transplant hepatologist at Mayo Clinic in Rochester, Minnesota. And I've been asked to give a brief description and summary of the study called Determining Safe Washout Period for Immune Checkpoint Inhibitors Prior to Liver Transplant, an international study led by the team in Geneva, Switzerland, with Drs. Moakley and Tosa leading this initiative. As mentioned in the editorial that accompanies this study, we absolutely need high quality data anytime we're broaching these topics about immune therapy and checkpoint inhibitor use in solid organ transplant patients. Early experience, unfortunately, resulted in high rates, or at least quoted high rates of rejection in transplant recipients. Obviously, we've gotten a little more familiar with how to manage these patients, and those rates really are unfortunately continuing to be quoted, despite the fact that they are unlikely to be the real risk to these patients. So there's liver transplant's a little bit of a different commodity in the organ transplant world, in that we can actually have patients receiving these drugs before transplant or after transplant. So it's unusual territory where you can actually still be using these medications and get a transplant. And that's going to be in these liver malignancies, HCC or cholangiocarcinoma. These patients get it prior to transplant. The majority of other transplant recipients will receive the immune therapy while they're on immunosuppression, which is a much more challenging risk-benefit ratio and challenging to prevent rejection. These patients that are getting these medications prior to transplant, there's still a risk of rejection, of course. One of the most important aspects of this is figuring out how much time we need from exposure to these medications and transplant. And this is what this team from Switzerland has tried to address. We need to be aware of the half-life of these drugs, which borders on 3 to 4 weeks for most of them. So it's going to require many weeks to actually have a reasonable washout period. There's been a couple of small studies out there that have suggested, obviously, the longer you wait between the immune therapy and transplant, the less likely there's rejection. And what the team in Switzerland have identified with a fairly large cohort of 119 patients is they were able to define a finite washout period of 50 days as a risk ratio, or as a risk time for rejection that actually equals the general population of transplant recipients. And so we're not trying to look for zero risk, we're looking for the same risk as every other transplant recipient. I think this is exceedingly helpful for us as we're sort of broaching these patients. What they've also identified or confirmed is the suspicion in some of the smaller studies that high volume of blood transfusion during the operation can reduce the risk of rejection, and that's essentially diluting the immune therapy in the bloodstream. They weren't able to confirm that the length of time on the immune therapy prior to transplant impacted, but they also had a relatively arbitrary cutoff of 8 cycles, which likely impacted that particular outcome. So I think we definitely need more data on that. But they've contributed, a great amount that can help us in managing these patients prior to transplant. And I think it's incredibly important for us in transplant. Immune therapy has revolutionized cancer outcomes in the general population, and we have not made progress in our transplant recipients' overall prognosis when they develop cancer, which is still one of the biggest risks of mortality after after any transplant, honestly. And we need to be able to use these agents and the upcoming agents that are going to be immune-based. And it's of paramount importance that we actually make progress in our long-term outcomes in these patients. So we need to approach these drugs with respect, but not with outright refusal. And this is a study that helps us to start filling in some of those gaps. And we need more high-quality data that we can actually live symbiotically with these agents and help our patients.